Student Association dedicates every month to a different department, and March is Environmental Health Month. My name is Amanda Quintana, and I'm the Environmental Health Department Liaison. So we put together this panel because a lot of us, most of us, are graduating in May. And if you're not graduating, you're just curious as to what you can do with your MPH degree, especially with the Environmental Health Department coursework we've been taking. So we have a panel group here who have really impressive resumes and backgrounds, and I've tried very hard to minimize their introductions. I'm going to give an introduction to each of them and then pose a few questions to have them answer, and we'll open the floor to discussions. With me today, who's going to be holding the open floor discussion, is Joanna Prodrowski here. She's also in Public Student Association with me. You can help yourself to some food outside and water as well. All right, so I'm going to get this correct. Dr. Michaels is not here right now, so I'm going to start with, oh, you are here.
Yeah, Dr. Howard's not here.
Dr. Howard, sorry. Okay, so we have, okay, I'll start with you. We have, oh my gosh. Okay. Sorry. Okay, so David Michaels.
You're not going to read all that.
Oh, no, I'm not. I won't. No, it's too much. Okay, so David Michaels is currently, he serves as the United States Assistant Secretary of Labor for Occupational Safety and Health, and is on a leave of absence from the university currently because he's fulfilling his position. Dr. Michaels is also the author of Doubt is Their Product, How Industry's Assault on Science Threatens Your Health, and was nominated by President Clinton as the Department of Energy's Assistant Secretary for Environment, Safety, and Health. In the past, Dr. Michaels has received several awards, one of which is the American Association for the Advancement of Science and Scientific Freedom and Responsibility Award for his work on behalf of nuclear weapons workers and for his advocacy for scientific integrity. And then next to him, we have Dr. Dean Lynn Goldman. She's the Dean of Milken Institute School of Public Health, and prior to her position here, she worked at Johns Hopkins University Bloomberg School of Public Health, and she was a professor there in the environmental health sciences. Prior to joining Hopkins, Dr. Goldman was assistant administrator for toxic substances in the U.S. Environmental Protection Agency from 1993 to 1998 under President Bill Clinton. And Dr. Goldman also worked in environmental health for the California Department of Public Health Services. A lot more than that. So, okay. And then George Gray, who's also here with us today, is a professor in the Department of Environmental Health here, and the director of the Center for Risk Science and Public Science, Public Health. Oh, Public Health. We missed that here. Prior to joining the Milken Institute School of Public Health in 2010, Professor Gray served as assistant administrator for the EPA's Office of Research and Development and as the agency science advisor. He's also executive director, or was executive director of the Harvard Center for Risk Analysis and a member of the faculty at the Harvard School of Public Health. During his government service, Professor Gray served on several committees, such as the National Science and Technology Council, and co-chaired the National Nanotechnology Environmental Health Initiative. He was also on the FDA Center for Food Safety and Applied Nutrition and National Institute of Environmental Health Sciences. Okay. And I should give a little brief introduction for John Howard. Okay. So Dr. Howard, who's not here right now, is the director of the National Institute for Occupational Safety and Health and in the U.S. Department of Health and Human Services. Dr. Howard also serves as the administrator of the World Trade Center Health Program in the U.S. Department of Health and Human Services. He was first appointed NIOSH director and under George Bush administration, and was a consultant with the U.S. government's Afghanistan Health Initiative, and was again appointed NIOSH director under the Barack Obama administration. He is a member of the U.S. Supreme Court Bar and is a professional lecturer here in Milken Institute of Public Health. Okay, great. So, I have a few questions to ask the panel. And the first one is just about a brief background of your career path. So many Milken students will be graduating in about a little over a month. And a lot of them are curious to know what the first job each of you had after graduating with your said degree, whether it be with your PhD, MD, MS, and PH. Would you be able to tell us about your first job after graduating and the career path that followed to bring you to where you are today? Yeah.
Okay. Well, I took a somewhat circuitous path. I was actually a history student as an undergraduate and got a job afterwards at Rikers Island in New York City. Prisoners are the only people in the United States who, oh, there's Dr. Howard. Sorry.
You were introduced. Yeah,
Good. So, anyway, the Supreme Court had ruled some years earlier that if you take away someone's liberty, you have to feed them, and you have to give them shelter, and you have to give them medical care. And in New York City, at the time, the city health department ran the Rikers Island Infirmary and did terrible jobs. They gave the contract to a hospital in the Bronx called Montefiore Hospital. And I was hired by people at Montefiore to help out and be a research assistant. I was, I had a bachelor's degree, no background. I was working on that, and two people really influenced me greatly. One was Mervyn Susser, who wrote a book called Causal Thinking in the Health Sciences, and someone gave me this book, and I read it, and I said, I want to be an epidemiologist. I had no background in this at all. It's a fabulous book. He was a close friend of Nelson Mandela. He sort of worked in the ANC in South Africa and was in exile in the United States when he wrote that book. Actually, it was the England book. So I read that and said, well, this is a great way to describe the world. And then Tony Mazzocchi, who was a leader of the Low Chemical Atomic Workers Union, set up a program at Montefiore to train medical students and others using workers to teach them occupational health, and I got involved helping in that. And that was my sort of career path set that way. I got involved in occupational health and in epidemiology. And I did, until I got more into policy, I crunched numbers. I did studies in epidemiology of worker health issues, and I ran worker education programs and did some helping employers address safety and health issues. But I think the interesting point to make is that I took sort of I didn't take a clear path that you would predict. It actually ended up making choices which looked like they were sort of backwaters or making choices that said these aren't the high prestige places. But out of that came much more interesting work. I was on the faculty at Einstein College of Medicine, which is a very prestigious place. And I got offered a position at a small fast-track medical school at City College in New York, which is very unprestigious. But it was a wonderful place to go, and I enjoyed it tremendously, even though the chairman of my department at Einstein thought I was just a fool to leave the center of academia, to go to this sort of backwater place. Similarly, I had a Robert Wood Johnson Health Policy Fellowship, which brought me first to Washington from New York, where I worked in Congress. And all of my colleagues went to work in the Senate, and I went to work in the House. And this was in 1994 or 93, when Congress considered President Clinton's health reform proposal. And I had a fabulous time and was given a lot of responsibility because there was no one else there to work on the stuff, while the Senate was just filled with all these experts. And so I think that the interesting thing, which I sort of learned, is sometimes the more prestigious path isn't necessarily the one to get you to the most enjoyable and rewarding, not necessarily financially, but really sort of psychically and professionally rewarding place.
Maybe I'll go. So I actually developed an interest in environmental health when I was an undergraduate, and I was in Berkeley, and I was in a program called Conservation of Natural Resources that allowed us to customize maybe an interdisciplinary program, and I did environmental health, wrote my senior thesis about pesticides, actually the use of pesticides for the fire ant program. I'm from Texas, and I was aware of that, so I thought that was pretty fascinating. And I especially loved the agriculture library there. They still had things like the old pamphlets showing fire ants carrying off lambs and stuff. So, but I did medical training, pediatric residency, and master's of public health at Hopkins, and went into environmental epidemiology for the state health department in California. And I guess in a way, like David also, I was kind of the person that took the projects that nobody else wanted, And so I worked on epidemiology related to hazardous waste sites and exposures for communities. got very interested in the use of geographic information systems. Now we call it big data, and but also in public communications, risk communications, working with the public. I spend a lot of time with the public in meetings with them, working with various groups. Helped to start the lead poisoning prevention program there, but more and more kind of, and also did, the other thing was test cancer clusters, which was also fascinating to work on. And even this work that I did at this nuclear research facility in Southern California called Rocketdyne, which is where I met David.
Right.
Because I appointed him to be a member of the advisory committee to us. And I also met John then because he was at Cal OSHA, so we had this ties. But became more engaged with policy and national issues through the American Academy of Pediatrics mostly, but also the Association of State Health Officers. And so I always found that for me to be a good way to begin to bridge from being more of a scientist and also somebody who's doing work at the community level to working on policy. We're kind of in a context of helping the Pediatric Academy develop policy statements and things like that. And which is how I think I ended up being selected to go to EPA in the Clinton administration. And then, I've had the privilege of getting to do public health practice, as an epidemiologist, public health practice as a regulator, much like David is now, actually been a regulator, is a little bit unusual. Most of us never actually get to do that. And then after that, going to Hopkins, where I had a bit of an academic career.
Well, I guess I'd say you can't plan it anyway. You can't plan where you're going to end up. But all of us have interests that we followed. I came out of an undergraduate program in biology, and I wanted to do something kind of applied. I chose toxicology for my PhD degree. I got done with that, and I said, this isn't very applied. And I went off to a postdoc in something called environmental health and public policy, and I stopped working in a laboratory. My advisor told me I was throwing my career away. You could be a good scientist, but instead, I found that this world of applying science to public health decisions to be something that interested me. And I've had a great opportunity to work with lots of different people. And I think one of the things that is an advantage you have coming out of School of Public Health is you've rubbed shoulders with people in a lot of different fields. And I'll tell you, one of the things that when you get out there as a scientist working in public health, it's really important, is having basic respect for other fields and what they do. That lets you work with them better, it lets you communicate with them better, and it lets you do things that you couldn't do most of the time if you didn't have those other people around. So one of the things I'd urge you to do is to continue to look broadly at opportunities to do things that might look a little different. One of the biggest influences on my thinking that I've ever had came when I was a toxicologist. I'd always done chemicals and things like that. And the United States Department of Agriculture came to me and said, can you do a risk assessment for mad cow disease? Sure. So we jumped in and did it, but it required learning a whole new kind of science, working with veterinarians and people like that I hadn't spent time with. But it really stretched the way that I thought about risk. It stretched the way that I thought about public health. It stretched the way that I thought about how you can, the tools you can use to inform really important decisions. Like, what the heck does our country do when we find a mad cow? So be willing to, as you hear, kind of be open. Things will move. Do things that stretch you, and find a way to work with people who complement what you know. And again, coming out of a School of Public Health, you guys have had classes in leadership and epi and global health, environmental health, and social behavioral aspects. You're going to need all of that when you get out there to be a public health professional. Remember that those people have lots of skills, lots of abilities, and they can help you get done what you want
Amanda, could you repeat the question for Dr.
That would be
I gather we're telling stories about our lives. I got that
Specific
impression.
question, though.
This is a question.
The main question is, would you be able to tell us about your first job after graduating and the career path that followed to bring you to where you are today?
Oh, God. Okay. Well,
None of us are really doing so.
right, yeah. So, well, hi, everybody. Sorry I was late. You know, I had a really well-directed career path at one time, and then that's over. That was over. So, you know, you open up my high school annual, it says wants to be a doctor, and so I became a doctor. Everything was directed to that, and I did, you know, internship and residency and fellowships, and I was at UCLA. And I was hired in the medical center after fellowship to run the respiratory intensive care unit, which is like a medical intensive care unit, except everybody's got end-stage lung disease. So it's real fun. It's a fun job. And everybody's on a ventilator, and you manage ventilators. And, you know, it was the early days of being a hospitalist, and that's, you know, what some people do now. They never leave the hospital. They just do what I did. And so I did that for a couple of years, and I really started thinking, I'm not so sure I want to do this for the rest of my life. And there was a patient, I remember him distinctly, who had interstitial lung disease, end-stage lung disease, and he had been a worker at the Naval Shipyard in Long Beach, California, pulling asbestos and stuff out of a ship. Well, you know, I was a clinician. You know, we never ask how you get your disease. That really impressed me, and I started looking that disease up. And the next thing I knew, I was across town at USC talking to the head of preventive medicine, who happened to be an expert in this area, and he said, you know, if you're really interested in this area, you have to leave clinical medicine, you have to go into public health. And so I said, well, how do I do that? And I ended up at the Harvard School of Public Health that next year, and then everything kind of fell apart from there. Not that I don't recommend going to School of Public Health. It's a wonderful experience, and coming from where I do at the Centers for Disease Control, you have to have that ticket or you're not going to get anywhere. So, so what happened there, though, is at Harvard you could cross-register at MIT, and there was a class at MIT called Technology and Policy. So I'm getting way far away from managing ventilators now. And this was a course taught by a guy named Nicholas Ashford, who I'd never heard of, who wrote a book I'd never heard of and revolutionized a whole field. And I never heard of that. But I got into the class, and there were all these people from the Harvard School of Public Health who had been in occupational safety and health. I think they were born into little cribs that said occupational safety and health. And I didn't know half of what they were talking about, but the professor was interesting, and I really enjoyed the class. And unfortunately for me, there were a bunch of cross-registered Harvard law students. And in technology and policy, as you all know, you read law cases. And so I was with a friend of mine, and she and I decided to go to law school. And so we went to law school, and I graduated from law school. And I was looking on the bulletin board one time, and I happened to see an announcement for a fellowship in Washington, D.C., and I thought it would be fun to live in Washington, D.C. So I applied for this fellowship, which is a Food, Drug, Cosmetic Law Fellowship, so you work with FDA. And I went there, but I got hijacked. In my interview, the counselor to the secretary at that time of HHS said, you know, we need somebody to run a medical malpractice group for the secretary, because he's really interested in this. The malpractice rates are going sky high and all that. So I never made it to FDA. I essentially ran this medical malpractice liability group for a couple of years. I went back to California because I still hadn't taken a bar exam, and you know, a doctor that doesn't have a bar license really is a nobody. So I had to go back to California to take the bar exam, which I passed. The guy who had been the mayor of my town that I lived in California, San Diego, decided to run for governor of California. He was running against Dianne Feinstein. I thought, he'll never win. And I ended up licking envelopes and all that kind of stuff because I knew him. Well, he won, and who would have ever thought he could have beat Diane Feinstein? Anyway, she ran for the Senate. She's still in the Senate. So he won, and I got this, pamphlet in the mail saying apply for, one of these jobs, a political job. And so I checked, a couple things related to the Department of Health. But I forgot that on my resume, it said that I had done an occupational medicine residency and that I was board certified. Anyway, the state had just defunded the OSHA program. The governor had defunded the OSHA program, making federal OSHA's life miserable at the time because California had to be covered. The voters got so upset, and in California we have like a Greek democracy, so we can do initiatives, and they passed an initiative restoring the program. Everybody in California, except for me, because I had been in Washington, had been involved on one side or the other of this huge initiative. So when somebody in the governor's office saw that I had occupational, all of a sudden I had an interview with the Secretary of Labor who said, well, you'd be perfect for Cal OSHA. I said, I don't even know what this is, and I've never managed anything in my entire life. My secretary, who I share with 5 other professors at UCI, never even pays any attention to what I say. And no, you're fine, you'll be great. And I ended up a decade later at Cal OSHA, and then I decided that, I think I need to get out of this job. I think, a decade is enough. And I saw that there was, the director of NIOSH had just left to come to UCLA. And so I went and talked to her, and she said, oh yeah, you should definitely apply. And I said, but I'm not a researcher. Doesn't matter. So I applied, and because I had worked for a Republican governor, mind you, this was a Republican administration, a Bush administration. So without any degree of merit, and of course, in Washington merit never hurts, but it doesn't really get you a job eventually. That's how I got to where I am.
Great.
But
I
it
was
really-
subsequently fired by the Bushes, and then went into exile for a while, and then I got a call saying from the Obama people saying, we want to reappoint you. Now, I don't know how this happens, but it happens, and that was my story.
But we in the state health department love having you at Cal
Oh,
OSHA,
thank you.
just so you know.
Great, thank you. So we know you can practice environmental and occupational health in many sectors such as NGOs, private and public sectors, and government. Which skills do each of you feel were strengthened or weakened in some of your positions, and what did you take from these positions that you'd be able to share with us?
No, I just did.
Okay, sure. I think there are many skills, but I think in some ways a key one in public health is advocacy. And advocacy really is a skill, and it's something that we should be teaching. And if you want to be effective in impacting public health, advocacy plays a very important role. It's not the only role. You could be you could be a scientist doing research, things like that, but advocacy is a very important role. And so within that, what's really important is to learn how to write well, to speak publicly well, because you're always in situations where you have to convince people of the importance and the truth of what you're saying. You have to be well versed in the scientific background of the areas you're looking into, because you're not convincing without being at ease with the science and being right also, and you have to be really respectful of the science. But you also have to understand, I don't know if it's psychology or what it is that moves people. When I was working, I had a job at City College, which is in Harlem, and I had just come from working at Montague in the Bronx. These were like 2 of the centers of the HIV epidemic in the 80s in New York. And I was asked the question of, what do we do about all these kids who are losing their mothers to HIV? These are women who are either drug users or the sexual partners of drug users. And this before any sort of treatment of HIV. And there were women all through Harlem and the Bronx who were dying of AIDS and leaving kids who were healthy. And so what do we do about that? And I worked with a number of people at both of the institutions that wanted to address that. And so a question came up, how many are there? How many kids have been orphaned by AIDS? And since I was sort of the numbers person, I worked out Excel spreadsheet, essentially a pretty straightforward mathematical model based on fertility rates that predicted the number of children that would die of AIDS, children whose mothers would die of AIDS. We published it in JAMA, and it was very important in convincing first the New York State Legislature and then the federal government that there were a lot of kids who were going to die, who were going to be orphaned because their mothers died of AIDS, and they needed this program. And what was interesting is we had all these kids, but until you had a number, people didn't take them seriously. On the other hand, the number alone didn't really move people. The stories were what moved people, but you needed both. When I realized later, the number really probably didn't make a difference. If I had said 10,000 or 100,000, there were never going to be enough services for all of them, but you had to be able to sort of combine both these things to sort of make the case why you need to do that. And eventually that model was used in giving out Ryan White money and sort of, helping bereavement programs and other social service programs all around the country. But sort of thinking about what do you need to move people to make the right decisions around these things. And so I think that's really useful to figure out.
I mean, I would say initially in public health, because I was dealing with things that everybody was concerned about all the time. So I didn't have to go out and rip up the concern, but it was more of a matter of trying to learn how to discern very quickly what was important and needed time and attention, and what wasn't, and how to bring those things to a close. A typical week when I was in public health would end at about 4 p.m. on a Friday with a call about some crazy thing. And, release of something as on a schoolyard, or a cluster, or somebody who was maybe lead poisoned, or something like that. And being able to pretty quickly determine, is this real or not? Is something actually happening? Like, do I really need to spend my weekend doing this? Or can I quickly, actually look at the data and say, well, wait a minute, this is not unusual. Somebody's really upset about it, but it's not actually unusual. And I guess also, kind of along the same lines, figuring out, being able to chart a course toward, proactively, what did I want to be working on? What would be the most important thing I could be working on, that not just to address immediate issues, that, because in a state health department you're in a swirl of the immediate, there are just a lot of things flying around, but how do I chart a course toward addressing issues on a more fundamental level? And so in my experience, it was a decision to try to create a lead poisoning prevention program, because we didn't have one, and we knew that was a really important public health problem. And just programming time for that, and building the support for that, and an issue where maybe the parents weren't complaining about it all the time because they were too poor and they didn't understand what the problem was, they didn't know their kids were lead poisoned. And, but, it was our job to build the support for that. But, that was very important to learn, and something I'm still trying to do.